Thank you very much everyone to participate this reproductive health symposium and the book launch. Before we launch this book, I would like to say a few words how the subfertility care is way forward in terms of the northern province of Sri Lanka. So before starting about the subfertility care, the global trend of population also increasing, especially in the South Asian suburb. So on the other hand, if you take the global fertility and the subfertility, the fertility rate is declining by multifactorial factors. And as Dr. Balagovi said, that global subfertility prevalence, the very recent survey by the WHO released in 2023, revealed 1 in 6 couples are affecting. If you see, there are around 16 to 17% in the low middle income countries as well as high income countries are affecting by the subfertility. So, in a low middle income countries or the resource poor settings, where we are going and how we are going to address this problem. That's a big question because we need to balance the population and we need to give the health priority for the non-communicable disease, infection, and on top of the economical crisis and the basic needs. On the other hand, the fertility is declining, subfertility is also increasing. So we are, as a clinician, academic people and administrative people together to think the way forward to treat it. So the experience, as a clinicians, always we are starting with our experience. So I will briefly give an experience of my professorial clinic for the last 3 years. Around 800 couples are registered. And in that, if you take women age more than 35, around 38%. And interestingly, they are coming to see the first time for a subfertility treatment after 5 years, around 40%. So the burden is a main problem as experience. Then the treatment challenges. As we explained earlier, we have a lot of constraint to produce of subfertility care. And especially if you want to give advanced fertility, the cost and the resource are restricting. So the success rate when they are reaching us a bit late, the success rate is low. And interestingly, other one is the multifactorial. That's why the family physicians are emphasized on that. Not only if you can't see the subfertility or subfertile couple as a solid subfertile problem, it has a lot of multifactorial like psychosocial component, lifestyle problems, and other medical problems and advanced ages. So with this experience, we reflect and find out the solution, how we can do that one. So we thought about why they are late presenting, why the outcome is poor, not up to the level. And we are thinking about whether any systematic, scientific, evidence-based system is available. The solution is we had to detect early, educate them early, and we had to create a comprehensive model to address this problem. So if you want to address any problem, you need to find the way scientifically. So we do the research to see the burden and study the system, what is existing in Sri Lanka, and then we thought to reform the system. So as we aware, we started to measure the burden, the prevalence of subfertility in the northern province by the each districts. First, we have completed the study of Jaffna district. So the key element in this research methodology is a cluster-based multi-stage study. And we use the Kobo collectors, online data collection, and we made the real-time data analysis. While we are collecting the data, we analyze the data also. So interesting and eye-opener findings, around 18% of 18.8% of primary subfertility, altogether around 23%. 1 in 5 is affecting in the Jaffna district. So it's, as I said, it's a complex and wide spectrum. So the next we study about the existing system. The existing system, couple can go directly to the specialist, either in the government or the private sector, or they have to go by the primary health care system to the specialist. But all the points there is a gaps. The financial constraints to reach, there is inadequate knowledge, and there is inadequate knowledge of the primary care system to address the subfertility, and there is no proper referral system. The existing system is designed. Eligible couple registry is there, newly married couple registry. They have find out and they have to screen them and they have to refer appropriate time. However, this system is not existing with a lot of gaps. So what we can do, we study about the evidence-based system. So the FIGO produced the fertility toolbox for the low and middle income countries to address the fertility issues in a stepwise manner. Level 1, level 2 and level 3. Level 1 is a community of the primary care level, then intermediate care and advanced care. So we compare this to our Sri Lankan settings. We found this primary and the intermediate care is not established. So the 2019 Family Health Bureau said only 3% of women were subfertile women or the couple were identified and reported to the system. So the system is not vertically not moving. So ultimately the level 3, the tertiary centers with obs and gynae people or the subfertility specialist getting burdened. So what is the solution? Again, we approach the novel approach that, as Dr. Kumaran said, we are gathered here as a university academics, consultants, and the provincial and the primary health care system. So we planned the integrated approach. That means while we are doing the research or find out the burden and the problem, we started to reform the system or any changes to the system or the existing system to make any changes in the subfertility care. For that, I made a good core team. So one is Dr. Kumaran with me, the family physician. He is focusing on the implementation side. And Dr. Balagobi, he is looking after the male factor, male fertility. As we are aware, the male factor is a 50%. And Mrs. Kritika, she has multiple roles. She's basically journalist, women activist, and gender-based violence consultant. So she also joined with us to support when we are dealing with this subfertility care for the couple with the troubleshoot. So this is our core team is started to work on the system reforms. So as we par with the evidence-based levels of care, the level 1, the primary care, first we thought that is not properly identified early identification and referring system. We use the community health care workers as our tool to detect and refer to the next level. The level 2 is a capacity building of the intermediate, the medical officers, medical students, paramedics and the healthcare staff. And the third is we are not reaching now, we need to reach the affordable and effective assisted reproductive technology. So this is a level 1 care. So we have planned a community-based project that our dean mentioned about that. It's piloting in our university area, Emoch, Nallur. Community health care workers facilitated fertility care. And which is funded by the IMHO USA. For this thing, we have selected 5 community health care workers and trained them. Me and Dr. Balagobi written a book in Tamil, Kulandainmai Vilakkangalum Theervugalum, and in a book for the assisted reproductive technology. These are actually we wrote for the public, but we used as a base core module, base structure to educate these community health care workers, meantime the public. So the step 1, we did the feasibility and acceptability study. That was 6 months, was completed last month. The finding was so promising and give a lot of enthusiasm. We analyzed in the quantitative and the qualitative manner. We found there are a lot of detections and the pathway, the vertical pathway is moving in a right direction. And the quantitative way, we have done a focus group discussion with the stakeholders and found to have this model is feasible and acceptable. So the next step, we are piloting to see the effectiveness of the model which can make any changes. So the level 2, we had to empower and capacity building of the intermediate team, which is already been well established in Sri Lanka. So how we can empower them for the capacity building for the healthcare level workers, paramedics, and medical officers and the medical students. That's why we are gathered here and launching this book. So we have last week we have Dr. Balagovi and me written a book on perioperative care, and Department of Surgery inaugurate a certificate course in perioperative care, basically related to the surgery and the procedure, which is essential part of fertility care in advanced and the intermediate. So they empower the healthcare workers and the nursing officers. And there is another certificate course conducted, and we have released one batch also on andrology, which is so much of ignored and not much established field in Sri Lanka. The first time we conducted a certificate course of andrology, and the next January we are going to start the second batch, and we have released 2 books to deal with this andrology, seminal fluid analysis, and intrauterine inseminations. So these are the capacity building for the intermediate level people. And today we are launching this subfertility. Ola mentioned that is my book, but it is co-authored by Dr. Balagobi with subfertility, is half work done by him with the male fertility. So this subfertility book is going to focus for the medical officers, general practitioners who are going to handling the subfertile couple as a first level, first defense. And it is useful for the medical students as well as the postgraduate trainees with some multiple choices also. I would like to acknowledge, before launching the book, I would like to acknowledge our mentor, Professor S.Raguraman, who reviewed this book and give the foreword for us. And Dr. R.S. Jayendran is an andrologist, and he is always collaborating with our department andrology laboratory for the teaching and the research. And I would like to thank the Sarasavi publication to publish this book. And I would like to thank finally my demonstrators in the Department of Surgery, Department of Obstetrics and Gynecology. The sincere thank to the technical officers, Mrs. Dayalini, Ms. Sadhana, and my colleagues in the department and colleagues in the Department of Surgery to make this book successful. Thank you.